You can just send the next patient in. Oh, they are. Hello. I didn't realize you were waiting in my office. Well, let's get started. I'm just going to ask some basic questions first. Are you a new patient or a referral? Of course. Can you spell your first and last name? And can you spell that for me? Okay. And your date of birth? Okay. And when was your last visit? Okay. And what was that for? And are you still experiencing those same struggles? Okay. And are you currently on any medications? And how often? Okay. And if you're having and experiencing trouble sleeping, did you have a specific reason that you may think? Okay, I can look into that. I'm going to run through a few cranial exam tests to just make sure that we're on par in certain areas and that there is nothing that is setting off any alarms for me. And then I'm going to look into what you said. But was there anything else that you wanted to discuss? Okay. No, that's no problem at all. I'm just going to go ahead and get some gloves on and run through a series of tests. Some of them are a little unorthodox, so just bear with me. We'll get you out of here. Not too much longer, maybe about 20 more minutes. Okay. I'm just going to take a few notes and get my other paperwork out. Also, make yourself comfortable, relaxed. If you have any questions at any time, just let me know. I want to make sure that you don't feel uneasy at all during any of this exam. Well, I'm glad I can help a little bit. Now, let's see. What is your sleeping habits like? At what time? Okay. Do you wake up often? Do you have to go to the bathroom during the night? No, it's okay. I just want to check all the boxes. Now, what do you eat right before bed, and what time do you stop eating? And do you drink anything before bed? Or do you take anything to drink with you to bed? And do you drink alcoholic beverages? How often? That could be it, possibly, but if it's occurring when you have weeks where that doesn't happen or you don't drink, then usually after a few days it gets out of your system, so it really shouldn't cause too much problems there. Are you taking any unprescribed medications? Okay. Do you smoke at all? Now I'm just going to set this down. to check over a few areas on your face first. Then I'm going to do a few tests. Don't worry, the tests are going to be something that I'm going to just know if you pass or fail. Nothing you do will be able to help you pass or fail. Okay, so I'm just going to get a little closer. Look at the eyes. Let me know when I'm just tapping if there's any sensitive spots. I'm just going to tap. And the sides. I'm going to get a little closer to the jawbone here. Just feel. Okay. And this side. Okay. Now I'm going to just rub around. Okay. Feel around the nose. Let me feel underneath the chin. And the front. Okay. None of that felt uncomfortable for you, did it? Okay, well, I'm just going to have you look at my finger here, and I'm going to have another finger on this side. I'm going to just be moving them closer, farther away. One might be closer, one might be farther away. I don't want you to move your head. Keep your eyes, just focus on my nose. And I just want you to use the eyes around your head, your peripheral view, to see what you see and tell me. I just want you to tell me whether I'm holding up a finger on the left side or the right side or both. Okay, sometimes I might trick you, not have one up at all. Just, again, relay what you see. Let's begin. Again, just focus on my nose. Okay. You're doing good. You're doing good. Now let me know how many fingers you see. You're doing wonderful. Keep going. Only a few more. Wonderful. Now, I'm going to get a little closer. Just going to separate my fingers, and again, I want you to just focus on the nose here for me. And when they leave your view, I want you to tell me when, okay? We're going to run this a few times, and then I'm going to move them around a little bit. I'm going to do this with the light in just a little bit also. So let's just focus and let me know when they leave your view. Some might leave faster than others. That's okay. You're doing wonderful. Just keep focused straight ahead on my nose. This might make it a little harder to focus. Going great. Now, I just want you to follow my finger with your eyes. Moving your eyes now. Don't move your head though. Just move those eyes. Try not to move your head. If it goes out of your view, that's fine. Okay, good. Switching to the other finger. I want to test all your senses just to make sure you don't have anything going on, because that underlyingly could be causing you sleep issues. Good, you're doing good. Now I'm going to keep both of my fingers up, and I just want you to watch them the best that you can. Okay, good. I'm gonna go get my light. Stay here. Now, same thing, just look at the light here. Don't move your head. Focus on my nose. Okay. Sorry if I told you to look at the light. Look at my nose. I just want to see how your eyes respond. I'm going to check the left side first. If this at all gets a little bit too harsh or you're a little bit sensitive, let me know. You're doing wonderful. Okay. Now I'm going to have you not move your head again, but use your eyes to follow the light. Follow the light. Follow the light. I'm going to do another test shortly, and you're going to let me know when it leaves your view. But for now, just do the best you can to follow the light without moving your head. Good. Now, head straight, staring at my nose. Let me know when the light leaves your view. Okay, good, good, good. Again. Okay, again. Okay. Okay. You're doing wonderful. Just keep telling me when it leaves your view. Okay, good. Only a few more. Then I want to take a few notes. Good. Good, okay. Did you feel any uneasiness when any of those tests were being performed? What about any sensitivity issues? And when I was touching around the face, was it anything that caused discomfort? I remember I asked you, but I forgot. I know I can be forgetful, but can't we all? Just going to write a few other last minute notes. I now have a few different containers here that have a few different smells. What smell do you smell? Don't worry. You do not need to know the answer. And what about that one? Okay. And this one here. Much fruitier. And last one. They are all different. Do you think this one was what kind of citrus? Okay, good, good. Now I'm just going to have you come back to me for a deep sleep test if this keeps happening. For now, I'm going to write you the prescription and give you a little meal plan that I would like you to follow, along with the guidelines of what time to be done eating. If you eat a little bit late or drink a little bit late other than water, it can just keep you up all night or make you a little restless, or those frequent bathroom habits that you're having. So I'm going to just let you do your best judgment on these times that I put, and I'm going to be putting a range. That way it's just easier for you to maybe maintain or feel like you have control still. And I'm going to write multiple meal plans, and you can also pick up my little cookbook that I have in the front, but don't feel obligated. I'm going to write you plenty of recipes, so we'll see how that goes for you first. Were there any other questions that you had for me today? It's no problem. You're welcome to come back anytime you need. And again, if you're still having those issues, we will do a deep sleep prognosis and deep sleep examination, but I'll need you to stay here late at night. That'll be a late visit. Let's hope we don't have to go there, but you never know. No, it was my pleasure. We'll see you in the future. Bye.